Hi, Dr. Adams, physical therapist here at Bowie Chiropractic and Sports Medicine, and today we wanted to talk a little bit about tennis elbow. So tennis elbow is an overuse injury that can either be acute or chronic. Most often, by the time you're seeking help for your elbow pain, it's become a chronic condition. And what that means is that there's actually no longer any swelling in the joint, but that the tendon itself has started to degenerate. So a tendon attaches a muscle to a bone, and your extensor tendon attaches this muscle here on the top of your forearm, which extends both your wrist and your fingers to the side of your elbow right here. So as this muscle is overused and overworked, it starts to lose its elasticity and flexibility, which causes a lot of extra pulling right at the extensor tendon. All of the extra pulling on the tendon starts to develop small micro tears in and around the tendon around the elbow, which starts to cause a lot of pain and tenderness right on the side of your elbow right here. Also, as this muscle starts to lose its flexibility, with any sort of repetitive elbow flexion and extension, you're going to get a lot of extra rubbing of the tendon along the bony prominences of the elbow, which causes the tendon itself to start to break down a lot quicker than it should. So the main symptoms of tennis elbow is pain and tenderness at the side of the elbow, as well as weakness and pain with any sort of gripping or lifting activity. So the primary goal of treatment for your tennis elbow is to regain the flexibility of the muscle, as well as rebuild and heal that tendon itself to be a healthier tissue. So when you come, primarily we first start with a lot of manual hands-on techniques right on the muscle and the tendon itself to rebuild the flexibility, which will help decrease the pulling of the tendon and decrease the pain at the side of the elbow. As you progress through your treatment, we'll continue with manual techniques. However, we'll do it during the full range of motion, as well as weighted lifting activities, so such as lifting a weight, working on the muscle while you're lifting. And that's going to help rebuild the flexibility, rebuild the strength of the muscle and the tendon, and get that elasticity back in the muscle.